presentation, I invite Dr. Rishi Sethi, who's Professor of Cardiology. And for this session, I'll request the chairperson, Dr. Shrikant Shrivastava. Dr. Shrikant Shrivastava is Professor of Department of Geriatric Mental Health. And he has authored and co-authored several national and international publications, and also working as a reviewer for many reputed professional journals. He is having an active association with different societies and academies, received several awards for his contributions to scientific community, and has major research interest involves geriatric psychopharmacology. Over to you, sir.
Thank you, sir. Good afternoon to everyone. So before I introduce Professor Rishi Sethi, I'll just carry on from the last lecture. This week of mine was spent in using ChatGPT for statistics. So give the outline of the research data. It will suggest the tests, how to go. And then I found another site where you can actually go and say, this is the data set, and do this test on these columns, and it generates SPSS-like output. So I think it's something to be explored more. It's helpful for academicians and researchers. So Professor Sethi, he's Professor of Cardiology, a very accomplished interventional cardiologist, researcher, and author. He's also the Executive Director of SIPSHINE, which is a project in collaboration with IIT Kanpur. Additionally, he holds roles as Associate Director of AICT, Member Secretary for Intellectual Property Committee at KGMU, Member of the Senate at IIT Kanpur, Associate Director of CHIP CTO. And I'll be here for 15 minutes if I keep reading all his affiliations. So he's been a Georgian throughout. And then later, after doing DM in cardiology, he completed a fellowship in interventional cardiology at National University Heart Centre, Singapore. His professional achievements include multiple awards, such as from Cardiological Society of India Travel Award, Professor Dhavendra Kumar Young Investigator Gold Medal Award, as well as leadership roles in the Indian Heart Journal and the Cardiology Society of India, where he is the current Vice President of the UP chapter. Welcome, Professor Sethi.
Humbled by the kind words, sir. Honorable Pro Vice Chancellor, Madam. Most distinguished Chairperson, distinguished senior faculty members of the university, our esteemed guests from outside, colleagues, ladies and gentlemen. The job that has been assigned to me is to discuss with you all our journey in innovation and entrepreneurship at the university. Many of you are already a part of the ecosystem. Many of you have already been exposed to what we have already been doing. So I seek your pardon and in a little bit of repetition that you must be observing in my talk as we go forward. But I can't help myself, although for the sake of time, just 1 minute to comment upon the last lectures, and we have been playing around. Sometimes what the crux of the whole matter is, then before we start on the whole venture of utilization of AI in healthcare, we can keep on talking about it in terms of, vague hypotheses and symbolisms. But until and unless we understand, most of us will use AI as a vague, generic term for most of the advanced computing technologies. AI is, of course, a much generic term, and we use it in a very superfluous and a loose kind of a way. But the first step maybe is to expose the university faculty to, various components of the nomenclatures and components about what are the difference between cluster mapping and organized cluster mapping, non-organized cluster mapping, big data analysis and deep neural networks, and all these kind of things. Until unless we know that nomenclature and know the basics ABCD of various arms of AI, how to use them in various technologies. Are we using it for data analysis? Are we using for image analysis and clustering of images? Are we Are we using it for the interface in the kiosk system? Are we, what is the kind of role we are having? So it's a very complex gamut. And I think the first step should be to understand the nomenclatures. And that is, for that, we should be making efforts to, teach our university faculties. Coming on to this talk today, the fact is that our agenda today is, firstly, I would like to discuss why we busy clinicians, all of us, when we are engrossed in our daily mundane activities, why do we need to exert ourselves to go out of our comfort zone and go venture into innovation and entrepreneurship and this journey? So why do we do what we do? What has been our journey and what are the lessons that we have learned? Is there a unique milieu in our university or any other academic institutions that provides a breeding ground for innovation or future entrepreneurs, medtech entrepreneurs? Is the question that is faced by most of the leading universities, it's should you focus more on core research and clinical research, or you should venture more into the translational research, which has got a larger, translational value in terms of science applications to the whole society? What is that debate? Which is better? Which should be funded more? That's a debate that has been rattling most of the universities and healthcare funding agencies. What provides a larger value in terms of going forward, in terms of diversification of resources? And then I would take the example of COVID crisis and one other crisis, that a Second World War crisis, and how they accelerated the research in medtechs and many other aspects of science in their relation to society. So the first question is that why do we venture out into these areas when all of us are busy in our clinical activities and we have our own families and personal passions and hobbies to go back to? Why do we need to do this thing extra beyond our normal call of duty? The answers can be many. It can be passion for creating something. An intelligent, inquisitive mind, if you do not provide it a positive diversion in terms of something which is an add-on to your work, an extension to your work, is more likely to go into disintegration, degeneration, and involving itself in the negative energy. So that is one of the reasons that it keeps us positively energized in something that is not so diverse from the clinical spectrum that we do. It's an extension, but still it's something new. It keeps our gray mattering from degenerating. And this hope that if the innovation or if the idea does see the light of the day, then the whole idea of it, our efforts impacting much larger sections of society and our patients, as compared to the limited number of clinical patients that we see in our lifetime, is something that also is at the back of our minds. And of course, it's an endeavor, whether it's a futile endeavor or it's a worthy endeavor, we don't know that, but it's an endeavor of every human to leave a legacy. So you always think that if there is an innovation that carries your name, your patent that carries your name, you will have your legacy going forward. So basically, essentially, all the faculty members who are involved with the SIB Shine and the innovation entrepreneurship ecosystem of the university are driven by either one or the combination of most of these reasons. Now, medtech technology is essentially trying to solve and trying to provide solutions to the need gaps in medicine with the help of technology. And that solutions of those needs gap may positively impact the life of the physicians, the doctors, us. It may positively impact the life of the patients that we treat. And of course, it may also positively impact the overall healthcare system, let's say, of the university, of the society, of the country, and so on and so forth. And health, if provided, this impetus of medtech can have the overall impact of the socioeconomic growth of the country, elevating the healthcare standards, and also boosting economies from an economist point of view. Now, we are a part of the School of International Biodesign. There are two. The first program that came up was the AIIMS IIT Delhi program that was called as the Stanford India Biodesign Program. Later on, the Stanford University divorced itself from that program, and the Stanford India Biodesign became the School of International Biodesign at All India Institute of Medical Sciences, Delhi, and IIT Delhi. Now we started, when we applied for funding to Government of India Department of Biotechnology, we wanted to call our program Shine. which stood for Synergizing Healthcare Innovation and Entrepreneurship. But government said that let's expand the SIB family. So the second SIB has come up in a collaborative affair between King George's Medical University and IIT Kanpur, and we call ourselves SIB Shine. So School of International Biodesign, Synergizing Healthcare Innovation and Entrepreneurship. The whole journey started in 2018 when we started to collaborate with engineering institutions, predominantly IIT Kanpur, to send their undergraduates and postgraduate students for summer immersion. So for summer, during the summer breaks in between May to June, July, the undergraduates and postgraduate students used to come to us, did their clinical immersion with various clinical subspecialties and various consultants, and they went back with ideas, and many of those ideas went on to become, not many, I would say, but of 2 years, when we chased around 18 to 19 fellows, we had around 4 to 5 patents, 2 company formation, 2 BIG formation. Dr. Arshad's proctoscope and 1 obstetrics and gynecology device got patent and company formations happened. So this was a very short program in terms of just 4 to 6 weeks of these students coming and going back. Now, energized with the success of the summer immersion program, we applied for the SIB Shine, and we enrolled our first batch in 2022. And the first cohort of the Shine Fellows is already over, and the second cohort of Shine Fellows is undergoing their training right now. It's a 1-year full residency program where the students split their time between KGMU and IIT Kanpur. For first 3 months, they do the summer immersion, find the need gap, identify the need gaps, go back to IIT Kanpur, try to develop products, prototypes. Then they come back to KGMU for the product validation. That's the whole ethos of the program. We are up till now have trained or are in the process of training 16 biodesign fellows. More than 200 need statements have been identified. More than 52 products have been chased. And apart from the summer immersion, in the SIB Shine program, we have 6 working prototypes. I mean, remember that 9 have completed and the remaining 7 are still going on. We have 4 patents that have been filed. 2 startup companies have been incorporated. We have won 2 BIG grant of BIRAC, which is a highly prestigious ignition grant for biotechnology given by BIRAC. We have got 2 BIRAC awards till now, and we have more than 40 consultants of KGMU who are involved in this ecosystem at our end. Now, what are the lessons that we have learned? That's the third thing. We have learned that we can, rather than just thinking hypothetically that we will create this, we will do this, we have, in the small journey of 5 to 6 years, although we have no product that have reached the commercialization phase, but still 4 to 5 years is a small time in the overall window of development of medtech products, and we are still learning ourselves. But we have felt that the small success stories that we have got, we have felt that medtech innovations are a realistic possibility in our environment. We can do it. But the point is that many a times, and I was hearing the Steve Jobs interview, which said that many of us, the problem that we face among our faculty members also, that everyone seems to have a great idea. And the problem or the real hurdle is that we think that the great idea is the only thing. The great idea is just the starting point of this whole journey. It has to be followed up with equal or probably more time to develop that idea into design, into alpha prototype, into a beta prototype, into an industrial level prototype, thinking about the intellectual property protection, thinking about regulatory approvals, company formation. So it's a huge, huge game. And just having the idea does not mean you can have a product. So this is what we have learned, that conceptualization is the first step, but it has to be followed up with a very long process and a hard process, but an exciting process of the entire journey of medtech innovations. This whole debate about frugal innovations, again, between the funding agencies and governments, we are fighting that whenever we go to government or funding agencies, they say you must have cheaper options for the Indian healthcare problems. Now, I may be wrong, but it's my personal view that that's not the right way to do it. In the world of globalization, we cannot have a jugaad technology and think that it will rule healthcare as our innovative product over years to come. All of us are carrying 2 lakh worth of phones in our pockets, and 10 years ago, we would not have thought that this would happen. So until and unless you have a great product, it's not going to see the light. It's not going to be absorbed by a large percentage of physicians or doctors or the patients. So I think you should have cutting edge innovations. You should plan and think for cutting edge innovations. And then once you have achieved the product, you can, of course, find ways to make it a little cost effective. And this will automatically happen because the point that the Indian manufacturing ecosystem is much, much cheaper than the European or the US systems. And we feel that rather than having the end product or the commercial outcomes, that rather than having that at the first point of our journey, if we innovate selflessly, then probably the impact we are going to make would be endless. We have also learned that handshake simply just, I have an idea and this is an engineer from IIT Kanpur, let's make a product together. A simple handshake is not good enough. We have to make the formal marriage happening, a long-lasting relationship between the two institutions, two innovators, along with the fellows, and this whole team. If they work in a selfless and a non-partisan manner, then probably the outcomes would be maximum. Idea is the key, but then very few people are willing to give time and energy beyond their comfort zones to execute their ideas into clinical products, and that has to be learned by all future entrepreneurs. How we select an idea, how do we take it forward? We have certain criteria. The idea need to fulfill the 4 basic criteria. The idea should be addressing a need gap in medicine. It should be a unique idea. That is, it is not a repetition. It should have some intellectual property value. The third, it should be feasible to create that idea in the ecosystem that we work in. There are different set of ideas that can be translated to commercial success in the Indian IIT Kanpur KGMU setup. There would be a different set of ideas when we talk about MITs and Stanford. So we have to realize what are the ideas that we can take forward in our ecosystem. And the fourth point is whether it's got a market or not. We create a product and nobody is willing to buy it, and that's also not a good idea. And after we have solved these 4 basic questions, essentially for us, the decision as program directors and program managers is that we have to divide these ideas into 4 kinds of fruits after fulfilling the 4 basic criteria in what kind of fruit they are: high-hanging, high-yielding, low-hanging, low-yielding, low-hanging, high-yielding, and low-hanging, low-yielding, high-hanging. So essentially, for the early part of the program, we have to think about low-hanging, high-yielding ideas, and we should take them forward in our journey. Now, the strength is that we have got a great team here in terms of, I'm really, really thankful for most of the faculty members who devote their time and energy to this program. We brainstorm a lot. We have an ecosystem which provides the platform for the future entrepreneurs and medical innovators in terms of, we have hand-holding in terms of technology support, intellectual property protection, regulatory approvals, company affairs, so on and so forth. So our job basically is to provide an ecosystem where all these brilliant minds can come together and create something new. The core research versus the translational research. Traditionally, universities have been considered a breeding ground for core research and clinical research. And that's what we have been doing over the last years. Some departments working on core research, most of the clinical departments working on clinical research. But now the translational research is happening. And I think the universities, rather than being they are not just a center for core research. Just because you have diversity in terms of knowledge base, when you have departments where both clinical as well as the core research is happening. So one diversity is a horizontal diversity in terms of the number of departments that you have. Another diversity is in the vertical diversity. You have undergraduate medical students, postgraduate students, PhD students, junior level faculties, senior level intellectuals. So the vertical and the horizontal diversity in any university and KGMC is an ideal breeding ground for translational research also. And I think we can work on both the sides of research, core research, clinical research, and the translational research. Just a small point about, this was a slide I actually made during one of the COVID presentations. You see, World War II and COVID kind of were 2 situations where human beings were subjected to the existential crisis. And when you are subjected to existential crisis, your research in terms of survival research, the science goes away from the core research and goes on to the more for translational research and tries to find out that how we can create value, human being touching propositions, changing our lifestyle based upon all the core research. So the transition between the core research, the transitional research happens many a times during times of existential crisis of societies, which has happened to the likes of World War II and COVID. And I think we have learned our lessons from COVID. MedTech innovations has got too much attention now, both in terms of society and in terms of medical fundings, funding agencies, government, universities, all of us alike. And I think we are just starting on our journey. These are just baby steps. We want all your wishes and all your support in the way forward. Thank you so much.
Thank you, Professor Sethi. Very enlightening. And are there any questions in the audience? Or shall we check the
online
हाँ ऑडियंस अपना सवाल पूछ ले कमरे में जब तक हम लोग वो चैट बॉक्स चेक करते हैं.
Okay, because we are running a little short of time, so I'll request Dr. Shrikant to felicitate our speaker, Dr. Rishi Sethi. Thank you, Rishi, for the wonderful presentation. Always a pleasure to listen to you. इसके बाद डॉक्टर हर्षवर्धन PPT, sir. I'll request Dr. Shalini Bhalla to felicitate Dr. Shrikant Srivastav. Are there any questions? Okay, so there are no questions in the chat box for the previous presentation.